This is the overview of my presentation. In that, I'm covering the introduction, impact on animal health and productivity, common tick-borne diseases in sheep and goat, factor influencing the prevalence and how tick transmit the disease to the animal, and prevalence of tick-borne disease in India, diseases life cycle and pathogenesis, diagnosis and surveillance, control and management strategies, and conclusion. With this, I'm starting my presentation. As you know, India is global leader in the goat production and ranks second to the sheep production, and goat commonly known as a poor man cows because of its low maintenance and high return. Sheep and goat are important livestock raised for meat, milk, and wool, and are valuable food resource for growing population in developing country like India. Tick infestation is second to the mosquito in terms of their impact on the animal and human health, and ticks cause a significant economic and health impact on sheep and goat. Come to the life cycle. As you know, the adult female, which lay around 1,000 to 1,500 eggs, and which goes to the and which reach to the cracks and crevices and laid egg, and where after 12 to 14 days these eggs convert into develop the molt and develop the larvae, and these larvae go again molt and form the nymph, and nymph again molt and form the adult. And this is the life cycle of the tick. Come to the health impact. Although the population of sheep and goat in India is growing, their production per animal is still low due to the various factors. Among these, the ectoparasitic infestation, particularly the tick infestation, represent a major concern. The blood loss due to tick and anemia. As you know, the ticks are voracious blood suckers, and ticks is high in. If the tick population is high, it may lead to the tick toxicosis and tick paralysis. In India, sheep and goat are susceptible to the range of tick-borne diseases such as caused by protozoa, bacteria, rickettsia, and viral, some extent to the viral. Come to the protozoal disease like Babesia and Theileria are most prevalent, while rickettsial infections such as anaplasmosis or ehrlichiosis also contribute to the morbidity and productivity losses. Though the viral diseases are less common in small ruminant in India, the vigilance is necessary due to the potential mechanical transmission by the tick. They also damage the skin and cause irritation, inflammation, and lesion, and also cause the stress and irritation. The reproductive issues, they reduce the fertility rate in infested animal. Come to the economic loss, they reduce productivity by lowering the meat, milk, and the wool yields, and increase the veterinary and treatment expenses. The cost of veterinarian visit and diagnostic and frequent use of the acaricide. Labor and management burden also increase the time and the labor required for regular tick control and treatment and treatment for the monitoring. And they also reduce the market rate of the animal because of its poor health and appearance. And if the tick infestation is very high, the animal may die due to the tick toxicosis or tick paralysis. Come to the common attachment side. Ticks prefer to attach the area or the animal body where the skin is thin and soft, and the the area is the rich for the blood supply. For example, ears, perineum region, around the eyes, neck, udder, etc. These spots also provide easy access to the blood and some protection from the animal's grooming behavior. The goats are alternative source for several tick species when the appropriate host is when their appropriate host is unavailable. For example, the Rhipispalus microplus, a tick species that mainly affect cattle, can also complete its entire life cycle on goat. Come to the common tick species in sheep and goat. Rhipispalus, Hyaloma, Haemaphysalis, and Ambyloma are the commonly reported from different parts of the country. These tick species are responsible for the transmission of the disease. For example, the Rhipispalus microplus transmit the Babesia, and Anaplasma, Rhipispalus sanguineus, transmit found in sheep and goat and transmit the Ehrlichia. Rhipispalus haemophysaloides also transmit the diseases, and the come to the Hyaloma anatolicum. Anatolicum is responsible for the major vector as Theileria species. Hyaloma marginatum is CI, which is commonly found in the goat and is having the zoonotic importance also. Come to the Haemaphysalis. Haemaphysalis bispinosa can transmit the Babesia species. Is Haemaphysalis intermedia also transmit found in the humid area and transmit the number of diseases. The Ambyloma intigum is most common tick in the goat and cause the severe skin irritation. Similarly in the goat also, these are the tick species. They are found and transmit a number of the disease. If you talk about the report in India, the tick infestation are more frequently reported in large animal due to a greater research focus and more severe symptoms and for a better surveillance. In contrast, these are the reports from the different part of the India and the large ruminants, but in contrast to the small ruminants, in contrast to the small ruminant, the infestation of sheep and goats are underreported due to limited attention, milder symptoms, and less veterinary access. And even though they still suffer significant health and productivity losses. These are the reports from the West Bengal, Kerala, Tamil Nadu, Jammu, and Madhya Pradesh, Andhra Pradesh, and Karnataka. And the factors and these are the factors that influence the prevalence, like the host related factors, the species and breed. Indigenous breed may have the better tick resistance than the exotic breed. If we talk about the behavior, the goat roam here and there more, that increase the exposure to the tick infested area. Come to the environmental factor, the climate. The hot and humid climate is favored to the tick breeding. And seasonality, peak infestation occurs during the spring and monsoon months. And come to the management practices, the overcrowding, which increase animal to animal transfer of the tick, and the regularity tick control, the irregular use of acaricide that lead to higher tick infestation or even the acaricide resistance in the tick. The veterinary access, lack of the veterinary care, limited access in the rural area, or delay diagnosis on the treatment, and the farmer awareness, the low awareness in the tick control methods among the small scale farmers, and presence of the reservoir host, the mixed grazing with cattle, dogs, and other wild animals increase the tick spread. Now come to how the tick transmit the disease to the animals. So there's a two method, transstadial transmission and transovarian transmission. The nymph stage transmit the infection. When come to the transstadial transmission, the nymph stage transmit the infection when they have acquired from during the larval stage, and the adult stage transmit the infection when which they have acquired infection during the nymphal stage. And the significance of the transstadial transmission helps to maintain the pathogen persistence within the vectors pathogens over its lifespan. Come to the transovarian transmission. Is transmission from one generation to the next generation. Example, the from the parents to the offspring through egg, And the significance of the ovarian transmission is help to maintain the pathogen persistence in the population across the generation. Come to the tick-borne diseases in sheep and goat in India. These are the common diseases, protozoan, rickettsial, and viral diseases which uh, transmit in India. Now we will discuss one by one. Come to the theileriosis. In year 2022, Dr. Ritu Ugelia conducted a meta-analysis study on the prevalence of theileriosis in the small ruminants and reported the prevalence of theileriosis was 28.69% in goat and 44.55% in the sheep. And the disease is prevalent across the geographical range and including India and also in the tropical subtropical region of the India. These are the 6 species which are affect the goat, sheep, and goat. In that, Theileria leucardi, previously known as Theileria hershey, and Theileria lewensuni, which is these both species are highly pathogenic, and in India, Theileria leucardi, Theileria lewensuni, and Theileria ovis are commonly found. And Theileria ovis are less pathogenic compared to the Theileria leucardi and lewensuni. Transmission is transstadial or stage-to-stage transmission in case of theileriosis, and these are the vector Rhipicephalus, which transmit the Theileria ovis and Theileria leucardi, and Hyaloma species, transmit Theileria leucardi and Theileria separata, and Haemophysalis species transmit Theileria lewensii. The life cycle, come to the life cycle and pathogenesis. The infected tick sporozoite inject into the host during the tick feeding. The sporozoite invade the host cell, host leukocyte, especially in the lymphocyte and macrophage, and transform into the cyzone inside the leukocyte. And there is an uncontrolled proliferation of the infected leukocyte, and the resulting the swelling of the lymph node and decrease the immune system or immune suppression, which lead to the increased susceptibility of the secondary infection. Cyzone, which lead to the cyzone rupture and release the merozoite into the bloodstream, and these merozoites invade in the RBC and form the pyroplasm in the RBC. And there will be destruction, the hemolysis of the RBC, and the clinical sign develop. The clinical signs are the anemia, hypoxia, high fever, jaundice, pale mucous membrane, enlargement of the lymph node, respiratory distress, weakness, weight loss, and death in the severe or acute cases. Theileria leucardi cause the malignant theileriosis, whereas Theileria ovis cause benign theileriosis. Impact of the disease is significant morbidity and mortality in affected flock. Come to the diagnosis. The microscopic examination, the light microscopic examination, is considered the gold standard test, and the organism of this Theileria look like in microscopic after the Giemsa staining, the single pyriform rod and semicolon or oval, round, or nail needle-like. Come to the hematological changes. The microcytic hypochromic anemia commonly seen, decrease the total erythrocyte count, PCV, and hemoglobin. Serological test can be done like CFT, complement fixation test, and indirect fluorescent antigen test, and ELISA, the molecular test like molecular PCR and RT-PCR. They are most costlier, but they have high sensitivity compared to the light microscopy. Come to the treatment, the buparbaquinone, that at the rate of 2.5 mg per kg body weight is commonly, with the support is commonly used for the treatment of the theileriosis. These are the postmortem findings. The carcass shows emaciation and variable degree of icterus and super enlargement of the superficial lymph node, lungs congested, pedicle hemorrhage on the pericardium and endocardium, and the punctured necrotic ulcer seen in the abdominal mucosa, and presence of post-blue body in impression in spear, mostly, especially in the lymph node aspiration. Come to the next disease, babesiosis. The prevalence of babesiosis is 3% in the goat and 5.79% in the sheep, as reported by Gilead et al. 2022. And the species of the Babesia or Babesia ovis is the most pathogenic in sheep and goat, is endemic in Asia and Africa, and Babesia motesi is pathogenic, also pathogenic in the goat, and the remaining are not that much pathogenic. The Babesia organism are intraerythrocytic protozoan and frequently observed in domestic and wild animal in tropical and subtropical region. The transmission in case of babesiosis is both transstadial and transbovedian transmission. Come to the vector, the Rhipicephalus versa and Rhipicephalus eversi transmit Babesia bovis, and Haemophilus species that transmit Babesia motesi. Come to the life cycle and pathogenesis. The infected tick, especially the Rhipicephalus and Haemophilus, inject the Babesia sporozoite in the bloodstream, and these sporozoite invade the RBC and multiply inside the RBC and form the merozoites and rupture the infected RBC, cause the hemolysis, and result the anemia, hemoglobinuria, jaundice, hypoxia, and organ damage, especially in the liver and kidney, and develop the clinical sign like the fever, pale buccal membrane, diarrhea, hemoglobinuria, icterus, abortion in the pregnant animals, loss of appetite, lethargy, weight loss, and animal may collapse or sudden death in acute cases. In this picture, you can see the icteric oral mucous membrane and icteric conjunctival mucous membrane. Come to the diagnosis and the treatment. The microscopic, as you know, the gold standard test. And here in this picture, you can see the organism different form. The ring form from picture 1 to 4, and paired pyriform picture 5 to 8, and spectacle frame-like from 9 to 12, and line form from 13 to 16. And also the triplet and quadruplet forms are seen in 17 to 24. Okay. Hematological changes in babesiosis, the hemolytic anemia, thrombocytopenia, and leukocytosis commonly seen. Come to the serological test. The CFT, IFAT, and ELISA are commonly are sensitive and commonly conducted. And molecular tests like PCR and RT-PCR are used for the diagnosis of the the babesiosis. And come to the treatment, the amidocar dipropionate at the rate of 1 to 2 mg per kg body weight subcut, or diamazine or diamazine diaceturate may be used at the rate of 2 to 3 mg per kg body weight with IM with supportive therapy. The key postmortem findings are pale or ectric yellow mucous membrane, dark yellow is a coffee color blood, and liver enlarged, congested with the pedicle hemorrhage, spleen enlarged and soft, and kidney swollen dark. Come to the anaplasmosis. The prevalence of anaplasmosis was found to be 25.18% in the goat and 7.25% in the sheep, while the same the Gilead et al. 2022. And the etiological agent, Anaplasma marginale and Anaplasma ovis, are most commonly reported in comparison to Anaplasma central. The infections, the infectious vectors, this is the infectious vector-borne disease of the ruminants caused by the obligatory intra-erythrocytic rickettsial organism of genus Anaplasma. In any animal less than a year old, and they are more affected, and transmission by ticks, fly, or the mechanical transmission. Come to the life cycle and pathogenesis. The infected tick bite, the anaplasma organism, especially the nuclear ovis, enter the bloodstream. The organism target, they invade the RBC and multiply the multiplication of the anaplasma inside the RBC, and the host immune when the host immune recognize the infected RBC, the immune mediated destruction of the RBC, and this is phagocytosis and resulting the anemia, icterus, and hypoxia, fever, lethargy, reduced to the milk productivity, and in severe cases maybe the death. Goat may show the hypersensitive hyperexcitability and may bite the innate object. The impact of the anaplasmosis in the sheep and goat in India lead to the significant economic loss due to anemia, reduced productivity, and increased mortality, and especially in case of tick endemic area. Here you can see the in this periphery, the small round dot inside the RBC. Diagnosis, the microscope, as you know, that light microscopy is a gold standard, and you can see gold standard, and you can see the serological test, CFT, IFT, and ELISA, and molecular, as you know, PCR and RT-PCR. You can treat with the oxytetracycline with supportive therapy. The another reason we hate the ticks as they transmit the zoonotic diseases like KFD and CCSF. The KFD, it is a tick-borne zoonotic viral disease which with an estimated case fertility rate is 3 to 5% in the human. And this is transmitted by the tick is Haemophilus species and Ambyloma species. And similarly, CCHF is caused by the the Crimean Congo hemorrhagic fever virus, and it is primarily transmitted by the Hyeloma marginatum tick. And this virus can be maintained and in the transstadial and transovarian transmission way within the tick population. Come to the control and management strategies. The ITM, integrated tick management, the combination of chemical, biological, and cultural practices to manage the tick population, to reduce the reliance of the single method, helping to prevent the tick resistance. The regular monitoring and surveillance, the routine inspections of the animals for the tick and earlier detection of the disease enables timely the intervention and reduce the disease spread. Vaccines for the tick guard, Garvac, and sublution. These are the vaccines, but they are not affected and not available now. The farmer education and training, the workshop and training seasons to educate the farmer about the tick control and disease prevention, which empower the farmer to implement the effective control measures. And the other strategies like in large animals, the acaricides are most commonly used, which result in the resistance development globally. And this Indian scenario also, all the acaricides, cypermethrin, datamethrin, diazinon, fipronil, amitraz, and ivermectin has a number of report of the acaricide resistance. Managemental control, the animal sets should be cracked and crevices proof, and burning of wastage material should be done in corners of the shed. Rotational grazing should be done, and the manual removal of the tick, isolation of the new or infected animals should be done, and regular health monitoring by screening of the tick-borne disease should be done. Come to the chemical control of the tick. The acaricide class like pyrethroids and commonly compound are cypermethrin and datamethrin are commonly used because they are cheapest chemical available in the market. And the mode of action of these chemicals are prolonging the opening of the voltage gate sodium channel, that is S45 linker gene. And In case of the large ruminant, both the deltamethrin and cypermethrin are resistant in almost all the part of the country. Come to the OP compound, malathion and diazinon. These compounds are most commonly used in the agriculture sectors, not in the veterinary. And very few places this malathion and diazinon is used, and the mechanism or action is inhibiting the acetylcholine esterase. Ivermectin, which is commonly used after the cypermethrin and deltamethrin and subcut, and which is available everywhere, and the mode of action of the ivermectin is binding to the glutamate gate chloride channels in nerves and muscles cells of the parasite. Amitraz, Amitraz is little bit susceptible. It's not that much resistance, and very few reports of the amitraz resistance has been observed. Similarly, the fipronil used as boron. Come to the plant extract or nanoformulation, that is phytoformulations. Around 25,000 of effective plant-based formulation are available with use in the flock medicine and known to be rural community in India. Globally, around 200 plant species with the acaricide property or tick repellent property are known. Advantage of these phytochemicals are environmentally safe, low chance of the food contamination, less chance of development of the resistance, safe to the animal and human. So these are the plant extract which are examined for acaricide activity in vitro test, like larval packet test, adult immersion test, and these are the plants reports. And they are some in vitro reports also. These chemicals, these extract of the plants, medicinal plants are applied on the animal, and they show significant results and results to against the tick controller having acaricidal efficacy. And ageratum congeoides plant having a strong acaricidal potential, and it was examined, and these are the publication against in this can be used for the control of the tick, can be used for the tick control. Few the essential oils are also having the acaricide property, like neem oil, castor oil, lemongrass oil, eucalyptus oil, and curry leaf oil, garlic oil, sage oil. These are having the acaricidal can be used for the control of the tick. In case of the biological tick control, the birds, especially the desi birds and Ubelcus ivis, can be used for the tick control. And some reports we have seen, if the desi birds is not getting feed more than 30 minutes, then they can eat the search the ticks and the cracks and crevices or near the in this shed, and they can eat insect like fire ants, spider, and spiders and Hymenopterus flies that can eat the insect, these tick larvae or eggs, the plants, the Melinus and Pinus, or especially these are the Stylocanthus species can kill the tick larvae. If we talk about the entomopathological nematodes, that is Sternonimitidae and the Heterorabidae family, having the tick killing ability. Few products are available, biological products are available in market, that is the bacterial product, the Bacillus thuringiensis, commonly known as Dipel 2x-DF, which can be used for the ground at the rate of 30 ml per square meter for control of the tick. The entomopathological fungus, Metarhizium anispoli, and the Bruvili and Bruvili vesina to be used for the ground at the rate of 30 ml per square meter for controlling of the tick. The few indigenous breed, they are relatively resistant to the, they are not fully resistant, but relatively resistant to the tick and tick-borne diseases. And these are the goat breeds, in that the Barbary, West Bengal, the Black Bengal, Sirohi, Jamnapari, these are the breed which are relatively resistant in comparison to exotic breeds of the goat to the tick. Come to the conclusion, tick and tick-borne diseases pose a significant threat to the health and productivity of the sheep and goat in India, leads to the economic loss through the reduced meat, milk, and wool production, as well as increase the mortality and morbidity. The species like Hyloma, Rhipicephalus, and Humphysalis are commonly involved in the transmitting the disease such as theileriosis, babesiosis, anaplasmosis, and ehrlichiosis. The effective control of tick-borne diseases in sheep and goat require an integrated tick management approach, which includes the use of acaricide, phytochemicals, improved farm hygiene, strategic timing of treatment, early diagnosis, and prompt treatment. Educating farmers, strengthening veterinary infrastructure, and implementing the region-specific control strategies are crucial for reducing the impact of tick and ensuring the susceptible small ruminant farming in India.